Riveting content. Empowering your life. Welcome to the Sphere. This episode is sponsored by Houston Housewives of Finance. For more information on increasing your cash flow, becoming your own money manager, and to schedule your complimentary personal finance strategy, contact the Houston Housewives of Finance today at 1-844-700-4463. Looking to advertise? Join the Sphere's vast demographic reach of thousands of people all over the world. Send an email today to advertise@thesphere.tv or call us at area code 832-772-7789. KOG and Company. Are your unique gifts and talents changing the world? Do you desire to belong to a community of unity? Visit KOGpassion.com to learn more about the Unleash Your Dopeness movement.
Good evening, good evening. Thank you for joining us here on The Sphere. This is the Doc's Show. I am Dr. Uchenna Ossai, where we are here to educate, inform, and empower you about health and wellness topics. Thank you so much for joining us for the first time. Welcome. If not for the first time, thank you for supporting us. I am, of course, a dentist. I do own my own dental practice. It is Elite Dental Wellness, which is located at the corner of Fondren and Westheimer here in Houston, Texas. If you would like to reach me there, you can always call the office 713-789-8680 or go to my website, which is www.houstondentalwellness.com. If you don't need a dentist, or let me say you don't want one, you can follow me on Instagram at hotdoc.com or on Facebook, Twitter, Periscope, Snapchat, etc., Uchenna Ossai. So once again, thank you for joining me. Actually, my co-host Simone, Dr. Ellis, is out of the building per usual. I get her, once every other week or so, Elijah? Ish. So, of course, I do always find the best people to come in and co-host with me, and today is no exception. Today we have Dr. Ossai joining us from Austin, correct?
Yes. Hi, everyone.
Wonderful. Thank you so much for joining us. If you could please introduce yourself, tell everyone who you are, what you do, what you're about, etc., etc.
Absolutely. I am a pelvic health physical therapist. I'm also a pelvic health manager for the UT Health Austin department at University of Texas Dell Medical School, as well as assistant professor. So my focus is pelvic floor dysfunction, sexual dysfunction, anything going wrong below the belt, essentially, is my world of expertise.
So you actually went to a few schools. Let everyone know where you went to.
Yeah, I went to Boston University for my undergraduate degree. Then I went to University of Illinois, Chicago, where I received my doctorate in physical therapy. I went on to do my residency in pelvic health at Washington University at St. Louis. And then I decided I needed even more training. And so I went to University of Michigan, Ann Arbor, where I completed my certificate in sexuality, counseling, and education.
So, that's about 5 different colleges colleges and or universities from what I heard.
Yeah, about.
Yeah, that's really impressive. I mean, I feel proud about my 2. You should feel very proud about your 8. So, congratulations.
Thank you. I just follow the knowledge. I just go where they'll teach me.
I got you. And it looks like you're only one of 3 physical therapists in the world. Correct? With
Yes.
this specific training, I guess you would say.
Well, actually, I am one of 3 therapists in the world who has my AASEC, so the American Association of Sexuality Educators, Counselors, and Therapists, who has their certification in sexuality counseling.
Oh.
So, yeah. So there are a lot of pelvic health physical therapists in this country, in the world, who are amazing.
Okay.
But I'm one of 3 of them who has the specialized counseling certification in sexuality.
And can you say that one more time, that certificate?
Yes, it's I am a certified sexuality counselor through the American Association of Sexuality Counselors, or educators, counselors, and therapists.
Wow. Well, that's really impressive. And I would just like to thank you for joining me. I always feel alone in the studio when I'm here by myself, but I can sincerely appreciate you Skyping in and joining us on this wonderful conversation. Oh, Elijah, you don't count. You're always here. So I appreciate you too. Okay, so let's start off with a hot topic that deals with sex.
Yes.
Because that's pretty much what we're talking about today. We're talking about pretty much sex and the dysfunction of sex. And
Yes.
one of these things that's kind of going on right now as we speak is the idea of slut shaming and
Yes.
or Amber Rose's slut walk,
Yes.
right? And so, of course, there is, I mean, it's been a couple of years of her doing this slut walk. And, you know, I mean, she wears a cape that says Captain Save-A-Ho. And, you know, her current boyfriend, is it 21 Savage, had something like a poster that said men can be hoes too, or I'm a hoe too, or, you know, something along those lines, right? So tell me, what is it about, like, this embracing, I guess you would call it, of sexuality that has people either turned on about it or turned completely off about it?
Absolutely. So when you're talking about sexuality, most of us, our sex education is based on this patriarchal concept, you know, that it's very gender influenced. Like the man is the aggressor and the woman is the receiver or the victim, you know, the damsel in distress. And that's where a lot of that is coming from. You know, you on one side, you can have respectability politics. On the other side, people say, oh, I'm a slut and I'm fine with that. And I think it's amazing that Amber is now starting the conversation about sexuality. And I'm glad that 21 Savage is saying, well, men can be a hoe too. I'm like, well, I would love for them to take it full circle and say, we are all sexual. And we express our sexuality and our sexual veracity and our libido in different ways. There is no wrong or right way outside of, you know, always making sure that we're consenting when we're having sex. But then also doing something that we feel we want to do because we're getting mutual pleasure out of it. I would love for Amber to have a pleasure-focused, centered conversation with men and women, because that's where we need to elevate this conversation.
Well, and I think to parallel with like the discussion of like sexuality and sex and it being a healthy conversation to have. I mean, we're also in the midst of a firestorm with Harvey Weinstein, and of course, before that was of course the now defamed Bill Cosby. You know, that you have these situations of women who would probably consider themselves sexy caught in situations that they're uncomfortable with. And so I think you're right. I think there needs to be a full round, like a full circle conversation as far as like, you know, if you're gonna, and I guess what kind of confuses me about the whole Amber Rose slut walk is, are we glorifying having multiple partners? Are we like, I feel like that can be confusing, especially to my 12-year-old, right? So like well, she's not 12 yet, but you get what I mean. Like my 11-year-old can be confused by the idea of like what traditionally a slut has meant.
Right.
You
right.
know?
Well, I think what's interesting about this is that it's almost like Amber Rose is like is starting off at step 5, and we all need to go back to step 1 with like basic sex education.
Okay.
And understanding the historical layers to what she's talking about, because this slut shaming thing can be perceived differently from an African American woman, and it can be perceived differently from a Caucasian woman who grew up in the South.
Sure.
You know,
sure.
It could be, you know, does that make sense? Because when you're thinking about what is a slut, well, that's a social and cultural construct.
Yeah.
Right? Like they're assigning value to a specific action, and depending on the society that you live in, you can be a hoe or you can be a queen.
Right. So give me, I guess for me, I mean, because of what, like you said, the social construct that slut was for me,
Yeah.
where do you think as far as in any other cultures where you could be a queen for this? Like,
Right.
because, and it's just because I'm limited in this kind of course, field. The idea would be, where can that be? Where would she get that information, or where do people get that kind of soapbox to stand on to say, the reason why I don't mind you calling me a slut is because blah 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 blah.
Well, I think that has to start really young.
Okay.
Our sex education needs to start when our children are babies, where we can start from an anatomical standpoint, where we just teach them about their bodies and something basic like consent, and build on that as they age, because we can't necessarily control social, like what's coming into their brains when they're at school. You can only establish a strong foundation, which means that the parents and the teachers and the clergymen need to be comfortable discussing sex. They need to be just as well educated talking about sex, and therefore they can say, honey, this is what slut is, what people mean when they call you a slut. Right? But do you believe that you're a slut? Does kissing a boy make you a slut? Does kissing a girl make you a slut? What do you feel that way? So it's not a simple answer, but it's having that conversation and being comfortable having that conversation, because that's why we are where we are today. With Harvey Weinstein, with Bill Cosby, is no one established that comfort of just discussing the basic logistics of sexy time, as I like to call it.
Sure. And I mean, my biggest thing is that I am very, very, very open with my 12-year-old, because I feel like, the moment that sex becomes such a closed topic and such a you don't touch it unless you are only talking to someone like your mom or your best friend. Like, I'm very much like, these are the facts that you're going to learn now, because everything is at her fingertips at this point. All of our children's things are at their fingertips. So I'm very, very, very transparent with her, because I would rather you hear it from me first. And then if you come to me and then have you so comfortable that you can actually talk to me about any experience, anything. And also for you to be comfortable to say no to someone, and then be comfortable enough to turn around and say, this person has molested me, assaulted me, done XYZ. But because it can be, the discussion of sex can be such a secretive kind of closed door thing, then things like, and I'm not saying that this is why assault happens. That is definitely not what I'm saying. What I'm saying is that the closed lipness of it, the people who say, I don't want to talk about this anymore, and the hurt and all that, and the other completely psychological things that happen besides the physical pieces, become, oh God, this is so uncomfortable. This conversation about sex is uncomfortable. Versus being like, no, I'm going to talk about it because it happened and blah, 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 blah. So I think that there is definitely some really good information that can happen with the quote unquote slut walk. I just hope that, like you said, it does come full circle. Going to go into our first discussion on how we can all be more well-rounded, because this portion of the show is actually sponsored by Houston Housewives of Finance. Did you know that only 4 states in the United States offer financial education? 33%, or more than 77 million of Americans, don't pay their bills on time. 39% of Americans carry credit card debt from month to month, and 39% of adults say they don't have enough savings. Don't become one of these statistics. Let Houston Housewives of Finance advise you on increasing your cash flow and becoming your own money manager by scheduling your complimentary personal financial strategy. Contact Houston Housewives of Finance today at 1-844-700-4463 or email us at info@houstonhousewivesoffinance.com. Ask us how you can participate in a complimentary financial literacy workshop near you. Houston Housewives of Finance are the new faces of the new age of financial services. Okay, so let's get to talking about sex.
Sexy time. Sexy
Right?
time.
Look how big her smile got. I just want everyone to notice that her smile went from like just showing like the just 2 rows to like full. I see all 28 teeth. She's like, this is exactly what I'm here for today. Absolutely. Absolutely. So the reality of this conversation, I mean, we can sit around here and talk sex, but what we really want to focus on today or this evening is some of the sexual dysfunctions and functions that we have that aren't discussed. And one of them is painful intercourse, right? So
Yes.
And this is on the woman side, clearly. Right. We're going to start with women. Men, don't feel like we're going to leave you out because we're going to talk about you too. But women have and deal with painful intercourse, and it can be from the beginning, from the first time you have intercourse, all the way through, right? And some women, most, like I said, because sex is not a comfortable conversation, I do believe that holds back a lot of women from talking about it. So let me know what's going on when women are having pain during intercourse.
Well, so that is actually, and this is a really common problem. So when I see patients in the clinic and they say I have pain with sex, there's a lot of shame. And one of the first things I say is that at least anywhere from 40 to 60% of women in America have some type of pelvic floor dysfunction, whether that be pain, bladder dysfunction, bowel dysfunction, even menstrual cycle pain. So that's incredibly common. Now, when it comes to pain with sex, you can either have pain with initial penetration, deeper penetration. You can have pain with orgasm, pain with arousal. Some women experience pain after the fact. So they say, I still have so much bladder pain after I have sex. I just don't want to have sex anymore. It's not worth it because I'm laid up for days because of it. And the causes are multifactorial. Because if we all knew the causes as to why women are having pain with sex, like definitively, we wouldn't be dealing with it. Because it could be hormonal, it could be psychological, it could be musculoskeletal, so your pelvic floor muscles are too tight or they're not coordinated properly, so they're squeezing when they should be relaxing and relaxing when they should be squeezing. It could be nerve injury.
So I mean, it's from what you're saying. Oh, and by the way, Dr. Ossai is cool enough to just go by UC, so I will be interchanging them frequently. So UC, you're pretty much letting me know that if there is pain during intercourse, there are 15 different potential possibilities, from nerve, from it's in your head, from muscles being too tight. I mean, so when you tell me that, and that you said up to 40% of women deal with painful intercourse at some point.
At least that. So those are just, some population studies, and that's not even an accurate representation of African American and Latina women.
Really? So is it?
Because most of that research is done on Caucasian women.
That's what I was going to say. So you're saying, majority of this 30 to 40% that you're discussing is not even a women of color.
No.
So that number could go up, it could go down. We're not sure, but
right.
But we're basing these current stats on women that do not include women of color. And tell me this: why is that? What is the issue with that?
Well, it's the issue across all medical issues or health conditions. African Americans were primarily researched heavily when it comes to hypertension, STDs, addiction, diabetes, right?
Okay.
So we're poorly represented when it comes to issues, when it comes to true sexual dysfunction, when it comes to true pelvic floor dysfunction. You'll see a study here or there, a little sprinkling here and there,
sure,
but it's not necessarily showing us exactly the full picture. Because at the core of it all, for African American women or women of color, we're dealing with the macro and microaggressions of being a person of color in this country. And that has been theorized to be the underlying issue with all of the health disparities that you're seeing between Caucasian individuals and people of color.
Got it.
So it would be truly fascinating to see what the true incidence and prevalence of sexual pain is among Black women in particular.
Sure. And that to me is a discussion that we could go off and have an entirely different episode immediately off of, because realistically, the fact that you and I can't talk sexual health, you and I can also talk mental health. You and I can't talk a lot of stuff because our people of color do not get enough research done to figure out what's going on in that element. So, unfortunately, I do have to end Facebook Live at this point. However, I would like that not only our Facebook Livers, but our subscribers, our listeners, you clicked on here for 2 seconds. If you could just please subscribe to our show. We have a ton of major platforms that includes iTunes, SoundCloud, Google Play, Stitcher, and iHeartRadio, just to throw that in there. Review our show on iTunes with constructive feedback. We would love to hear what you guys would like to hear about. We would love to hear any sort of ideas that you want us to talk about, because yes, although we have a plethora, an ocean of topics, we want to know what you guys would like to learn more about, or if you have any amazing guests, we'd like to have them on as well. Share this Facebook Live post and the entire show with your family and friends. It's wonderful knowledge. We don't do this just to hear ourselves talk. And if you could, please reach into your pocket and donate toward the mission of bringing this kind of enriched and inspiring content to the world each and every week. You can donate at www.thesphere.tv/donate. Thanks, Facebook Livers. Okay, so you see, we have discussed. Literally, you went down the list. You said, and I'm trying to figure out a way to get comfortable, because I told you I'm 35 weeks pregnant. So clearly,
I got you, girl.
Clearly, we're having some sex around here.
Right.
My back is hurting. I'm like, oh, I can't.
Hey, find a comfortable position. I get it. Can I just add one thing about pelvic pain? I want women and men to know that it's not just in your head. And if your doctor or healthcare provider is telling you to drink wine and relax, find another provider and seek and get a sexy time health team. That means a urologist, a pelvic floor physical therapist, a psychologist that will help you manage this issue, because there is a lot of hope out there. So keep persisting until you get someone who will listen.
Okay, so pretty much there's the idea of yes, we have some mental aspects that can play into this, which
sure.
I would assume low self-esteem, bad sexual experiences in the past, things that can mentally block you from from having a good sexual experience with someone you care about, love, want to share this kind of very intimate part of your life with. However, the response of you just need to relax is not the end all say all.
No.
And who would you include on this team? You said a urologist, who else?
A urogynecologist if you're a woman. So that's a gynecologist who has had fellowship training in urology as well, so they can deal with both bladder and gynecological issues. An OB-GYN, a gastroenterologist, a colorectal specialist, a PT, a pelvic health physical therapist, so someone who has specialized training in dealing with pelvic floor dysfunction and sexual dysfunction, as well as a therapist, a sex therapist or a licensed family counselor that has experience with dealing with chronic pain or sexual issues.
So when you say team, you literally mean a team. Like you're talking about 5-6 doctors to go to figure this out. Well, and I am pro like having a healthy sex life. Like I am very much team. If you love your person, then y'all are committed to each other. Then you should have healthy sex. And so if you're unable to do that, then you need to be able to call up, a gynecologist. And if you're a male, definitely a great urologist, like people that can assist and figure out why your sex life is not healthy. And by healthy, I mean, as much as you want to have sex, that you're able to have it and that it is pain-free. So with women, we have nerves, and I mean, when you think about it, it's very intricate down there on both
Yes.
sides, men and women. You have many organs, you have things talking to things, you have things connected to other things. What do you think is the top 3 causes of painful intercourse in women?
I would say the top 3 causes is going to be hormonal dysfunction, or vaginal atrophy. So that vaginal atrophy can occur, after you have a baby, when you're breastfeeding, or postmenopausal. Another cause is just musculoskeletal issues and musculoskeletal pain.
Okay. So the musculoskeletal pain, talk to me about that. What does that mean in layman's terms to someone who's like, okay, I'm not postmenopausal, I'm not breastfeeding, and there's no hormonal issues. So what does that mean?
Yeah, so your pelvic floor muscles are the muscles at the bottom of your pelvis, right? So they attach to your pubic bone in the front and your tailbone in the back. It's almost like a hammock of muscles down there. And sometimes those muscles are so tight, or they have spasms, almost like a Charlie horse. And that may be provoked specifically with sex, like penetrative sex, or even arousal for some people. It could be a result of having chronic back pain or hip pain or abdominal pain. Because think about it, if you're having chronic back pain, it's almost like living next door to someone who's always partying. Eventually you're like, I want to join in on the party. I want my house to be loud and crazy. And so the rest of your muscles start to follow suit.
Got it. Kind of like right now when my lower back is actually killing me at this moment, I would suppose that my pelvic floor muscles are also tense or taut or tight or whatever.
Exactly.
Or it's because they've loosened up so much because I'm pregnant that my back muscles are like, ugh.
Exactly.
Okay.
Exactly. Your body's intelligent, so it's going to either underperform or overperform depending on what imbalance it sees.
Right. So right now my back right now, because my uterus is super heavy, is probably overcompensating, so it's always so tight. Because my pelvic floor muscles have loosened, my hips are looser, and it's carrying weight that it's not used to doing. So in this specific instance, for me, if I were to have, of course, a situation of having painful sex, it could come from many reasons because I'm at 35 weeks pregnant. However, in another situation, this could be like, what if someone just overworks out? Like, they've overdone it in the gym. Could that be a cause for painful intercourse?
Well, only if they strained a muscle.
Okay.
I've seen people who, a lot of male and female patients, or people of all genders really, overdo it, and they've strained a muscle. But it's like straining a hamstring. It's just they happen to strain a muscle in the genital area.
Okay.
Yeah.
Well, there we go. So give me some treatments for some of this for women. I mean, you can go down the line and then kind of hit on the big major ones, but what are some treatments for women when they do go to this kind of team of specialists? How are women going to find relief, and how comfortable is the relief? Sometimes we don't want to do something. We're already uncomfortable about the situation. We surely don't want to do something that's going to take us down before it takes us back up. Kind of give the pros and the cons to this kind of treatment.
Absolutely. So echoing back to the best patient outcomes are when you're part of a team, right? But a first step is that if you're going the non-surgical route, it's going to be topical hormones. So estrogen creams can be one thing, especially if you have vaginal atrophy. Another thing can be, some type of antibiotic if you have a fungal infection. It could be something as simple as applying some cream or lubricant if you're having a lot of dryness. You could have Botox injections.
What?
You could have, Botox to help chill out the muscles. You can have vaginal Valium or vaginal diazepam to help. Again, if you don't want to get injections, that's going to precede the injection. So that will be something your doctor will prescribe for you. You can use a dilator. So a dilator is almost like a vibrator, except that they can become bigger and bigger depending on how much stretching you need. And you can do even trigger point release on yourself to help relax those muscles. Something as simple as yoga, acupuncture is what I always recommend for my patients to help improve body awareness, but then also pelvic floor muscle relaxation. Those 2 options are excellent for patients.
So I always like for patients to hear the natural ways, which are yoga, acupuncture, those are some great options.
Yes.
And then, of course, the pharmacological ways, right, which are the
Yes.
creams and the Botox injections and the
Right.
diazepams and things like that you can actually physically inject. But of course, before you even go down that route, you need your team to help decide what is the cause, right?
Yes.
So
And your pelvic.
it would be
Oh, sorry.
pointless to I'm not saying pointless, but maybe the Botox injection won't help you too much if your issue is hormonal and you just need to get on hormones or to get off hormones or to put cream or so definitely no self-diagnosing here.
Exactly. And the pelvic floor physical therapist is going to be central to this because they're the ones that can say, okay, you know what? You have pelvic malalignment. We just need to get your pelvis aligned.
Oh.
Okay. They can perform internal manual therapy techniques. They can help work on any type of movement, spinal movement problems, pelvic floor movement problems. They can teach you the techniques to work on yourself so you're not dependent on the vaginal Valium to manage your pain.
So as a pelvic floor therapist, you're saying that
Yes.
you can actually, and when the first thing I heard when you said this was, a tilted pelvis. Like, are we talking about somebody that can actually be like a chiropractor to the coochie?
Well, yeah. So a physical therapist is going to do a whole postural assessment, right? Because your pelvic floor keeps the score. So if you have chronic postural dysfunction, if your belly muscles are like clenched all the time, they're going to be the ones to teach you, okay, look, relax your belly, stop clenching your jaw. Or if you need a little bit of manual therapy, they will do that. They will help manually manipulate the muscles or your joints so that you can be properly aligned and your muscles aren't, like we talked about earlier, overcompensating because of a lack of movement in one specific area.
Well, I think that is, I love like I said, I love the idea of everything starting off, and excuse me.
Oh, it's okay.
From a more natural route first,
Right.
and then seeing how we can manipulate, postures and muscles before we start using pharmacological, introducing that into your system. So let's talk about if you actually have your own business and you would like to advertise, because you can do that right here on the Sphere. Are you starting your business and looking for a place to advertise? Do you have a need to reach out to thousands of people across the world to build your brand or sell your product? If so, get your product placement and advertising needs handled right here at the Sphere. We offer a wide variety of content delivery platforms, including iTunes, Google Play, SoundCloud, YouTube, and Stitcher. Plus, we have a vast demographic reach within the United States, as well as modern countries across the globe. Our enriched content and inspiring dialogue, coupled with your strategic ad, is surely to hit the mark every time. Call us today at area code 832-772-7789 or send an email over to advertise@thesphere.tv. Okay, so the men don't get a reprieve on this, just so you know. We're going to talk about erectile dysfunction and explain to the world what erectile dysfunction is, UC. Like, what does that mean?
So erectile dysfunction is a man's inability to achieve an erection or to sustain an erection. And that can be due to a lot of causes. It can be due to hypertrophy of the prostate. It could be due to nerve injury. It could be due to pelvic floor dysfunction. So the things similar to what causes pelvic pain for both men and women can be the driver for erectile dysfunction. A lot of it also primarily has a lot to do with blood flow, because that essentially is what gives you the erection, is having the engorgement of the blood vessels to achieve an erection. So when a lot of men, when it comes to erectile dysfunction, they associate that with their manhood.
Of
and,
course.
Like they're saying, I'm not a man if my penis can't get hard and I can't perform for my partner. And I'm like, well, let's kind of take a step back here. Like, what's going on with your body? Because if you're not getting an erection, that's an indication that something is wrong, right?
Now with men specifically, I would suppose, as far as percentages, you tell me, this is my assumption. I would assume that men are quicker to go to the doctor to discuss their penises not working than women going into the doctor to say, when I have sex, it hurts.
Oh my gosh. I mean, let's just put it this way. The men that I saw with this issue, it's like they noticed erectile dysfunction 4 days ago, and I'm seeing them in the clinic 4 days later. Women, they will say, I've been married for 30 years and I've never had pain-free intercourse. So there's the difference.
Yeah. So I think that one of the biggest things is, like you said, I mean, the association of being able to have an erection, get an erection when you want it, as long as you want it to be, is associated directly to them feeling like a man. You know, like, I'm a man, this is what it's supposed to do, versus a woman who their association of womanhood is literally counterintuitive to having a healthy sex life.
Absolutely.
Like, we're not taught to even talk about sex. So never mind talk about painful sex or even talking about having enjoyable sex.
Exactly.
So we're not taught to do that, because if you're talking about having a great sex life, you're a slut or a hoe or a tramp or whatever. Even if you're talking about it with the mate that you've been with, it doesn't matter if you talk about the person that you were with for the last week. It's not acceptable. But a man can be like, yeah, my penis is the greatest thing on the face of the planet. And everyone's like,
yeah,
it is.
Oh yeah,
it is. So that's interesting to me. And I think I would hope that I want women to embrace the idea that sex should be mutually amazing.
Yes, absolutely. I mean, I think it's really funny that you say that, because men in my clinic will unapologetically say, okay, my penis isn't working. What do we need to do? Like, they're not, I mean, yeah, they feel bad about it. They're like, yes, my manhood, but like, they're like, what are the steps? Women, it's a little bit different. It's almost like they're grappling with the fact that they want to be sexual, and it's not socially okay for them to be sexual, but it hurts. And it's just, you know, it's really, really interesting. And that's where, going back to Amber Rose, I'm like, man, just have people talking about sex in a healthy way, just talking about it.
Yeah, because I mean, I could only imagine the intensity and the apprehension that a male patient comes in with. That fix me now. What do we need to do to fix me now? Versus a woman, like you said, who's like, yeah, I mean, sex always has kind of hurt. Or what we'll be talking about in a little bit is, I've never had an orgasm. Like, those are the things that women will be like, that's never happened. And men will be like, yeah, it stopped yesterday. So tell me what I need to do, because it stopped happening yesterday, you know?
Right.
So
exactly.
From what I understand, there's a lot of different causes of erectile dysfunction in men, and one of them could actually be a sign of heart disease.
Huge.
Okay.
Huge indicator, particularly for men who are, you know, in their 20s, 30s, who are having erectile dysfunction. The main two things that their docs want to look at is their heart or the psychological stress, right? So for younger men, their erectile function is directly linked to how much psychological stress they're experiencing, depending on how they're wired. But once you're over 40, right, then it's going to, we're looking at prostate, we're looking at diabetes, we're looking at hypertension, we're looking at psychological stress, you know, those types of things.
So 20s and 30s, if you're having erectile dysfunction in your 20s and 30s, it pretty much narrows you down to two kind of elements. One is psychological.
Top two.
Top two. You know, the differential diagnosis is more like, okay, you either have some maybe potentially heart disease, so we're going to shoot for that first. The second is some sort of psychological blockage.
Right.
And then there's 10 other things that could be going on. Yeah. But the 20s and 30s, that's the primary kind of, we're going to aim our gun first. And then when you get 40s,
or
50s, diabetes. Okay. So those three are the kind of go-to. But then when you get into your 40s, 50s and beyond, you're talking about prostate. It just broadens the what's going on element.
Right.
Okay.
Absolutely.
Okay.
But and another thing to consider, if you've been living with chronic pain as a teenager and you're going into your 20s and you're experiencing some erectile issues, it also could be your pelvic floor. It could be the fact that your whole body is sensitized.
Okay.
And it's difficult to achieve an erection if you have chronic pain.
Oh, okay. Well, that makes sense. That actually
Yes.
makes sense. So what's some treatment options for these young men, young, old men? Just what
Yes.
are some treatment options for them?
Well, the first thing is they're going to want to go to their primary care doctor, see a urologist or a cardiologist to get properly screened for any type of, medical issue. And the next step is to really consider seeking the counsel of a therapist who specializes in male sexual dysfunction.
Okay.
And helping them go through that. Now, if you're morbidly obese, if you're dealing with depression and anxiety, like again, maybe considering going to the doctor to get some talk therapy or some medication, but understand that medication that we use to address depression and anxiety can significantly impact your ability to get an erection, to have an orgasm. You can have premature or delayed ejaculation.
Got it.
But if you want to just simply improve your erectile function, improve your diet, exercise, stop smoking, check your meds.
Look at that. Exercise, stop smoking. Those are two important things with risk factors with erectile dysfunction is men who do not have any sort of physical activity and smoke.
Yes.
So for all the young ladies and or young men out there that are dating or are with a guy who does not work out and smokes, there's a high risk that there will be some sort of erectile dysfunction if he does not change his ways.
Yes.
Correct? Well,
yes.
I will say that part of this to me is that there's such a disparity in the conversation and in the treatment for this against women. And I feel like erectile dysfunction, you see commercials about it on TV. I mean, like,
yes,
no one cares that there's commercials. I mean, it's Viagra, Cialis. Like, there's no problem discussing on national television during prime time a sexy time commercial with a guy because he's not getting his full functional penis. Right. Versus you do not see any sort of discussion of Botox injections into someone's vagina on TV during prime time. You don't even see that at night. Mm-mm. So the idea that it can be and like you were saying, the gender roles that are associated with sex is so conflicting and it's so rooted in so much history that it's hard to break out of it, of course, right? And the fact that if you did a commercial on the uses of Botox, and one of them was painful intercourse for females, let's fix that, it would be considered lewd content immediately.
Yes, absolutely. Absolutely.
But you having the Viagra commercial of the guy and the woman in a bathtub and they're talking about what's Viagra saying, or Cialis, anytime, or be prepared, whatever that you're like, oh yeah, but a woman talks about it. Oh my God. It would be shut down. It would be, and I find that to be so sad.
Yes, because we have so many FDA-approved drugs and treatments for erectile dysfunction. Very, very few for women when it comes to sexual dysfunction.
Really?
Yes, very few. I mean, gosh, there are many ways to get a man's penis working. You can use injections. You can use talk therapy. You can use a pump. You can use medication. You can do an implant. For women, it's like drink wine and chill or don't have happy sex. Or you're crazy, or you're rich, or you're frigid. Is
it a lack of empathy and or a lack of females in the field that have not pushed for more science or more research? Like I'm trying to find the crack here besides it just being a women should not be as sexual as men conversation.
Well, I mean, I hate to get political here. But when
this is the platform to do it. Go ahead.
I mean, when you look at how many women voted for Hillary, not black women because we did our job, but when it comes to that internal sexism that women have, and I'm not blaming women, but I'm saying sexism across the board for both men, women, and everyone in between. Okay. That's a real thing. That influences what we research, that influences how we teach our kids about sex, that influences how we think about sex.
I got it.
And that that is a real challenge, because sometimes when I'm treating patients, they kind of fight me a little bit. When I'm like, well, let's talk about pleasure for you.
Sure.
And the concept of pleasure for women who, you know, feel so much shame for not performing for their partner, you know, it's saying, well, what about you? I feel bad for you.
I got you.
And
it's a complex thing. And in reality, a lot of it stems down to gender roles and gender assignments, and the fact that a sexy woman who has embraced her sexuality for millennials, and not millennial people, years, has been frowned upon in American society. Not in other necessarily societies, but definitely in American societies.
Yeah, we're pretty puritanical Americans,
which is kind of, and there's a shift trying to happen, like you're saying, but who knows how long the shift is going to take. So I don't have on my KOG and Company shirt because I've worn it like 3 times this week. So, however, I'm going to tell everyone where to get it from, because if you see me on Instagram with it, then you need to know where to get it. This portion of the show is sponsored by KOG and Company. Are your unique gifts and talents changing the world? Unleash Your Dopeness is a people empowerment movement built to encourage the masses to operate outside of their fears and have the gall to recklessly pursue their dreams and passions in life. Join thousands of others as we unlock the greatness that dwells inside. Shop dope gear at kogpassion.com. That's kogpassion.com and use coupon code DOPE for 10% off exclusive Unleash Your Dopeness apparel. Act now, sizes are selling out fast. I actually need to put it on because that's the night that the Astros won, so I should have worn it all day. Dang it. It's because I don't have my Unleash Your Dopeness shirt on. I'm convinced. Okay, so last but not least, let's talk about orgasms.
Yay!
Everyone loves an orgasm. People do not talk about them enough. Mm-hmm. And so I found this kind of article on Women's Day. Women's Day, right? Yep, Women's Day, which is a magazine. And it says that there are some truths about orgasms. And I'm just going to rattle them off and we could talk about them, right?
Okay.
So that orgasms can relieve pain. That's one. Condom use does not affect orgasm quality. 30% of women have trouble reaching an orgasm. Finding your G-spot may improve the likelihood of an orgasm. And orgasms get better with age. So I don't know when that stops, but I would hope that to the grave, that's a fact. Women who mix things up in the bedroom have more frequent orgasms. A woman's sexual self-esteem can affect the quality of her orgasm. There is an orgasm gap, which I would love to hear what that means.
Yes.
In rare cases, orgasms can happen without genital stimulation.
Absolutely.
And for most women, it takes a while.
Yes.
So, do you subscribe to all of these thoughts?
I do. Okay. I particularly when it comes to points 6 and 7 about women who mix things up at the bedroom have more frequent orgasms, and a woman's sexual self-esteem can affect the quality of her orgasm. I feel like those are basically the same thing. And I'm not saying that you need to be kinky, but the individual who's going to change things up in the bedroom is most likely chasing their pleasure and trying to look at different ways that they can experience pleasure, which means the orgasms always follow. If we don't make orgasms the point of sex, you have more orgasms.
Okay.
If you make pleasure the central point of having sex, if you chase your pleasure, your orgasms will start coming left and right.
Okay. So don't chase the orgasm, chase the pleasure.
Huh?
Don't chase the end result, chase the path to it.
Yes.
Enjoy the path.
Yes. Enjoy the path. And that's something that we're not taught from day one, right?
Huh.
We're not taught from that from day
now let me put my 2 piece in here. I personally feel like women have more patience And so, not that we're taught it, but we just have to be more patient. And so
Right.
it has to become a more natural thing because it doesn't take us typically 2 seconds.
Right.
Versus a man is not chasing the path. He wants the end result the moment that it starts.
Right.
And so to me, I feel like that can be a very tough topic to tackle in a relationship if the woman's like, okay, look here, I'm not here for this for 5 minutes. I'm here for this for, give me some time, okay?
Right.
And it's going to take me time, and I would like to enjoy the path. And
Right.
men are like, I can't enjoy the path because I'm really only here for the end result. Do you have this conversation with your patients?
All the time.
Okay.
All the time, especially with couples, because, men, they've learned when they masturbate, they can masturbate in less than 2 minutes and ejaculate and have an orgasm. And
yeah.
But it's for men, masturbating is so culturally accepted that they've perfected it. For women, masturbation isn't a culturally accepted thing. Right. And it's not something they're practicing every single day for the most part, and especially when we're teenagers or when we start going through puberty, right? Like we're like, oh, we tell our sons, oh yeah, go just make sure you do that in the bathroom or make sure you close the doors. For girls, it's like, don't do that. Don't do that.
No.
And so
you're right.
Women, we're not taught or it's not acceptable for us to start learning what's pleasurable. That's something we end up falling on or stumbling upon, whether that's in high school, college, or even later than that for some women. So it's almost about practicing for men, practicing that communication of sex, for women, like that reciprocity. For people of all genders, we need to start figuring out that talking about sex is actually quite sexy, and we need to give each other a roadmap to our pleasure.
I think that part of the, like you said, the ingraining of talking about sex and this is just my personal opinion, I think that there's a lot of people out there that can talk very easily in public about sex, and that's because it's surface, right? It's not,
right.
We're not really diving into sex when you're with your friends or you're like right now, I can talk very easily about sex, and so can you,
right.
Of course, and I can only imagine that you can talk about it all the time very easily. However, when it comes to your intimate partner and you're talking about the pleasure and the path to pleasure and all of that, I feel like that can become a tough conversation.
Very tough.
Especially both sides, meaning a man can take it like, okay, wait, so you're telling me I'm not good enough for you? And it's like, wait, no, that's not what I'm saying. What I'm saying is that these are the things I want more of, or I need this or I need that. I mean, is that where you feel like sex therapists should come into play?
Yes.
Okay.
And sex therapists, particularly sex therapists when there's deep-rooted psychological issues, like there's some, significant insecurity, history of trauma, things like that. But, also a sex educator and counselor can be helpful in terms of that communication. Right? Because I always tell people that your orgasm is your responsibility, not your partner's responsibility.
Right.
And once you take that burden off, then you can start to have a real open conversation about, no, I'm just telling you what feels good to me. How are you supposed to be in my brain to know what makes me feel good? Because a lot of times they're learning from porn or from what their friends taught them or what they were told in school, which may or may not have been accurate. Because let's be honest, for a lot of these school systems, they're not utilizing comprehensive sex education that's evidence-based.
Okay.
They're using abstinence-only sex education, which does not have to be based on true evidence.
Got you.
Just on the values of the community in which they're going to school in.
Sure. So if you go to a school that has very staunch, like Puritarian, like you were saying, kind of values, your sex education is very straight lined. Versus some place that may be a little bit more liberal. You have people that are happy to be gay and proud at the school. You have a lot of LGBTQ demographics in your population, and they're accepted and they're loved on. It's a liberal community. That sex education, I would imagine, would be much different.
Well, I think a lot of it has to do because President Barack Obama, before he left office, he mandated that comprehensive sex education needs to be the standard because it's evidence-based. So comprehensive sex education means that they're going to educate about abstinence because that's the best way to prevent pregnancy and STDs, right?
Right.
But then they're also going to teach about condoms. They're going to teach about birth control. They're going to teach about STIs. They're going to teach about all of those components of sex education. But that's also biologically based. They're still not teaching about pleasure. You know?
Yeah.
And consent is also a concept that's very confusing to a lot of individuals when it comes to sexual practice and even orgasms.
Sure. Well, because the moment you start talking about pleasure, especially with young people, the idea is going to be well, if it's supposed to be pleasurable and it's natural and all this, then now we're talking about having 14, 15, 16, not that they already aren't having sex, but then how do you steer that conversation from when is it appropriate to have sex? And I mean, It becomes a much more complicated thing. And God help me when my daughter, God help me, but it becomes much more complicated. So, I will say that this is a conversation that I think that you and I and Simone, when she gets back, could dive into some more. So I would love to have you back, or if you're ever in Houston again, you're welcome to come and be in the studio with us. However, I would like for you to at least give, once again, all of our listeners and viewers where you are. I know you have a website, so can you please point people in that direction as well? And kind of sign off for yourself and make sure that people know that you're a good resource to go to.
Absolutely. Everyone, I've developed a platform called UC Logic, YOUSEE Logic. My website will be launching next week, and I will have a website launch party in Houston on November 16th at the Flat from 6 to 8 p.m.
Oh.
And so I'll be posting that on my social media channels. And my platform is focused on sex ed for grown folk. So for all of us who are grown, but we want to know more about sex education. We want to have a fulfilling sex life, not only for ourselves, but for our offspring and friends and family who are struggling with sexual issues. So please follow me on Instagram and watch me on Bourbon Tales, where I get to drink bourbon and answer all of your questions about sexy time in a very safe and chill environment.
Well, I love that. UC. Thank you so much for joining us.
My pleasure.
She is an associate professor at
assistant
professor at UT Medical School in Austin, the Dell Medical School, correct?
Yes.
And, if you have any sort of idea of the amount of information that you could possibly give out, and if, of course, please feel free to reach out to, if you don't have anybody that you know of, I know UC would be a great resource for anyone. Mm-hmm. So please reach out to her. And once again, thank you for joining Docs here on the Sphere Network. I am Dr. Chandra Batiste. I am a dentist, so I can talk sex, but I can't talk like in a healthy fact-driven base. I can just tell you about my life. But if you want a dentist, I am located at my office, which is Elite Dental Wellness, located at the corner of Fondren and Westheimer. And you can go to my website, which is www.houstondentalwellness.com, or call the office, which is 713-789-8680. Of course, you can always follow me on Instagram at hotdoc.com and Facebook, Twitter, Periscope, and Snapchat, Chandra Batiste. We thank you so much for joining us today. Feel free to share, like, post, hashtag it, comment, all of that for this show. We thank you for your support, and please bring more people. Peace out. See you next week.
Thank you. Bye, everyone.
Thank you, UC.